Okay, welcome everyone. Hi, Dr. Williams. Nice to see you again. And nice to see you, Dr. Lome and Dr. Lim. Thank you very much for joining us.
A pleasure
Good to be here, Steven.
Great, thank you. So we all appreciate you taking your time and volunteering to offer this great information. We're in a interesting age. I don't know if you realize it, but from our end as a customer, when you get in touch with the doctor, you have to call to make an appointment, go on websites, fill out forms. By the time you actually get to them, it could be a long time and a lot of money and a lot of paperwork. So to have access to you, to hear your latest information, we're very fortunate. We make this conference free, but by no means should anyone even slightly think of this as a value that doesn't cost anything. This should probably cost a lot of money, but we make it free because we want people to hear this information. But again, we really appreciate you being willing to take your evening and share your information with us. So let's get started. I have a bunch of questions. So the first question is, should we cancel this panel tonight and just tell people to take Ozempic, which is a diabetic drug that is helping people to lose weight? Would that be easier than having to go through all this lifestyle stuff?
Absolutely not. It would not be easier. So first of all, I'm going to, maybe Dr. Williams and Dr. Lim have more to say about this because I personally do not treat obesity or diabetes in my practice being a cardiologist directly, but I understand the impact of these things. There's no question that having a proper diet and lifestyle is more powerful than any medication that we have available. Medications, are, maybe in some instances, in rare instances, a tool that could be used as a bridge to try to improve lifestyle, but they're not the solution. What we really want to look for in our evidence-based world, we want to see that some therapy we give somebody will prevent a heart attack, prevent a stroke, make them live longer, prevent or reverse some sort of chronic disease. And Ozempic, being newer, certainly shows weight loss and has potential for some degree of reduction of big events simply because of weight loss and things that you get with it. But it's only going to be at most a very small percentage likely, and nowhere near as powerful as changing your diet. So I think that everybody that focuses on lifestyle medicine would agree that the proper diet and lifestyle is going to be multiple orders of magnitude more powerful than any single pill. So it's no need to cancel this panel.
Yeah, I love images, and the image that's always stuck with me was back in 2014 when I saw Dr. Ornish take the stage, and he had the cartoon of the doctors mopping up the floor while the sink's going on full blast in the background. And that image has always stayed with me. And I've shared that image now with audiences and always credit that as the moment that something clicked. Because I had been part of mopping up the floor with prescribing medications like Ozempic and glyburide, or, whatever medications for high blood pressure, high cholesterol, and diabetes. And medications, as Dr. Lome said, they have their role, but we have to be very honest with patients that it is not turning the faucet off. We're dealing with the downstream consequences of not eating a healthy whole food plant-based diet, moving your body in a healthy manner, dealing with your stress in healthy ways. So if we can turn people's attention towards the elephant in the room, which is how they are living their life and the choices they're making on a daily basis, instead of looking for the magic pill out there, which does not exist, then I think we're doing them a great service. And if we can do it in a compassionate way where, we're not making them feel bad, I get it about, wanting to take the medication, but instead just, direct them towards the truth. I think that's key.
Well, if I can weigh in, you can hear me, right?
Yes.
So first of all, it looks like you've moved your conference on. Steven, this is the first time that I can recall seeing all the advertisements and starting with a video of commercial products. So I have to raise my hand and just make sure everybody knows that I do not associate with any industry whatsoever. I have to give this loud disclaimer, just because I still do AHA and ACC guidelines. And I also turn in a thing to the provost of the university saying whether I have relationships with industry, which is zero always. And I was trying to figure out how to hijack the conversation into making sure I got that in, but you started and said, did we cancel the panel? I was thinking, if I don't say something, I'm going to have to cancel me out of the panel to make sure I'm not associated with any products. Okay, but anyway, back to, I'm going to take a slightly different approach that says the exact same thing that Steve and Dr. Lome have said. The opposite approach is that, yeah, we have been mopping up the floor instead of turning off the faucet. That's American medicine. But you know what? Some of these mops are darn good, okay? And this is one of them. We have data with the SGLT2 inhibitors and the GLP-1 agonists that suddenly can take an unhealthy diabesity type of population and improve their outcomes. 26% reduction in bad events, statins at best were 30%. So they're just about as good. And none of the other MOPs that we have, by the way, are as good. Certainly not stents and bypass surgery. They're just a smaller selected population who benefit from them. We know now that more than we ever did in the past in terms of the ischemia trial. Good medical therapy outdoes revascularization, which we've been hearing from the plant-based nutrition people for quite a while. So I would say that my approach is that every cardiologist, we really do, if we rely on endocrinology and primary care to do the SGLT2 and GLP-1s, we're going to be behind the eight ball because they're seeing some patients, but we're seeing other patients, and they all benefit from these drugs. Now, that doesn't sound like I agree with you all, but I do, okay? Because wouldn't it be great if we never had to go on them? Or if we do the lifestyle to such a degree that we are actually able to get them off of them, have them not be diabetic anymore, have them not have heart failure, diastolic dysfunction with heart failure with preserved ejection fraction, all of the things that have shown significant benefits so that you can actually get FDA approval and at a tough time for FDA approval because of the benefits of these drugs. They're way better than what we've had in the past. But do we need to adopt them? Yeah, if we haven't prevented them. And if we haven't prevented them, it's on us. We need more of Steve's conferences to get to the people and get them to understand that lifestyle can prevent this stuff. But, it's great to have a fantastic mop that'll keep people alive long enough to change their lifestyle. And so that's the way I would approach it.
And while we're on this subject, in general, when people come to you, do you sometimes say, yes, go on a statin drug, that is the right course for you?
Yeah, so I would just say, if I can reverse the order this time, we don't, if you look at the pharmaceutical data, our uptake of SGLT2 and GLP-1s are not what they should be based on the data. But it similarly took a long time for statins to get where they should be as well. We have guidelines for primary prevention, secondary prevention that talk about statin use. You hear a lot of plant-based physicians or lifestyle physicians saying statins are no good because their side effects. Well, the side effects are relatively rare, and the risk-benefit ratio is really high. But people staying on a statin or staying on any pill is not as good as it should be. And so we've got to, come up with better ways of doing things. You could do you probably heard that we now have cholesterol medicines that can get us to target with injections twice a year. Really expensive, of course, which is a whole nother issue. It's looping back to the fact that I have no relationships with industry because I'm always talking about the pricing and how it disenfranchises the poor and increases our ethnic disparities. So anyway, we have twice a year drugs that you could infuse, and it would be great. But they lower LDL cholesterol, which is great. How about lowering TMAO, which you get from eating red meat? How about lowering inflammation, which you get from eating any kind of, I hate to say something that sounds gross in public, but carcass of, a deceased animal. You always are going to get inflammation. And so the only way to treat all three of those, TMAO, inflammation, and LDL, is a whole food plant-based diet.
Thank you.
And yeah, I think that, a good doctor has their pyramid in order, right? And so we're in the middle of a 12-day online program right now with the McDougall program. And when people coming in with heart disease, high cholesterol, diabetes, I'm not taking off every medication because I see that those medications have a role with the disease process where it is currently. But it's if I can get their focus on the very base of the pyramid to say that, hey, there is hope and there is the possibility, and we have lots of experience with people who are actually getting off these medications by dealing with the base of the pyramid. So let's keep them on as you're making this transition. The statin for our diabetic patients or patients with a history of stroke or heart attack. But also let's hold out hope that if you're really willing to deal with the root cause, there's a very distinct and real possibility that you won't need to take one or more or all of these medications for the rest of your life, which is a pretty compelling proposition for for most individuals.
And I would say that I agree 100% with Dr. Williams and Dr. Lim. There's definitely a role for medications and such. And I think that couple of things. One is as you're practicing medicine and seeing a lot of patients, you realize that there is, unfortunately, a good percentage of patients that no matter how much you talk with them about a healthy lifestyle and whole food plant-based diets and exercising, there's just too many barriers to them making significant enough changes in order to get their numbers at goal and lose the weight they need to. And not that you should ever give up, but it's really a failure of our system, of our healthcare system and our culture and our food system and government policies to make the healthy food available at a cheap price to everybody who needs it. And when you have these patients who are not able to achieve their lifestyle goals because of whatever barrier they have, you do have these other tools, statins, et cetera, that will lower their risk significantly and at least give them some benefit to some degree, even if it may not completely reverse the problem or it only lowers their risk of a heart attack or a stroke by a certain percentage. When you're treating hundreds of thousands or 1 million plus people with these, it ends up being a substantial number of people who end up getting, preventing heart attack, strokes, and improve their overall outcomes. So as much as we would all love every single patient that we touch as lifestyle medicine physicians to make dramatic changes and no longer need to be on these medications, that's just not the real world. Where I work at, I'm seeing patients that come into the ER that are having heart attacks and all these different things. They're not seeking me out for lifestyle medicine. And so a lot of times when I start talking about this, it's a deer in the headlights because they've never heard this before. Their culture has taught them different habits. And so at least we have these tools to reduce their risk to some degree. And the last thing I just wanted to say is that in regards to statins, we do need to let the audience know that there is a big difference between what we call primary prevention and secondary prevention. When you hear some people saying, oh, statins don't work that well to prevent heart attacks, they're mostly talking about what we call primary prevention, preventing the first heart attack or stroke. And there's a little bit less robust data that in the shorter term, that is going to have a major impact on lowering risk. It's more of a long-term thing, but secondary prevention, somebody who's already had a heart attack or a stroke, a stent, an aneurysm, the data is very strong about event reduction. And again, that doesn't mean you should ditch the lifestyle efforts, but there is very strong research to support the use of statins, and side effects, maybe 5 or 10% of people get muscle aches, you stop it and it goes away. So it's not like it's causing major harm. It's very rare that anything serious happens as a side effect from the statins.